Nearly 620 million people worldwide live with low back pain. Dr. Matt Fischer joins us. Dr. Fischer, you are an anesthesiologist and medical director of pain management here at ThedaCare. We appreciate you being with us.
Yeah, thanks for having me. Happy to be here.
So today we're going to talk about chronic pain, ways that you can cope with chronic pain, and maybe some treatment options that are available.
Perfect.
Let's talk a little bit about low back pain. What does that mean, and what does that indicate?
Well, there's a lot of reasons that patients can suffer from low back pain. We try and divide it between how recent the onset is. So if you fell off a bike and you have low back pain, that's something that's likely due to a muscle spasm or a muscle strain. Rarely you can have something like a fracture of the bones that leads to back pain. But statistically speaking, most of the patients that we see in the chronic pain offices here at ThedaCare have some combination either of degenerative conditions, that could be arthritis in particular joints in the back, or arthritis that's leading to pinching of nerves transmitting down in the low back, or what we call myofascial dysfunction. So myofascial dysfunction refers to the soft tissues of the lumbar region, so the muscles and those types of things.
When you have hip and buttock pain, that comes with maybe some low back pain as well. What does that usually mean?
When my patients report combination of pain in the hip and then radiating to the buttock or from the back down into the hip, we think about it could potentially be an indicator of underlying arthritic changes. Specifically, we think about arthritis in what are called the facet joints. So the facet joints, using this model here, are the small joints that are on the sides of the spine, both the left and the right side. And along with the disc that's actually at the front of the spinal complex, they help perform the articulations or the joints in between each level of the backbones. And so if patients develop arthritis in these facet joints, just like arthritis in a hip or a knee, you can experience pain from that pathology.
Another one we hear often is a complaint about sciatica. What is that, and who might experience something like that?
Yeah, so sciatica is one of many terms for pain that is described as radiating from the low back and then down the leg. The classic example is when the pain is due to a disc herniation or a disc disruption. And so again, using this model, there's discs that serves as the cushioning shock absorber in between the backbones. And for whatever reason, if you have a disc that's herniated out toward the side, impinging or creating inflammation that will activate these nerves that are exiting down the leg, then you can experience these searing pains into the leg known as sciatica. Sometimes we'll call it radiculitis or radiculopathy as well.
Who might experience something like that? Is there like a common type of patient that you might see?
Well, it tends to be a bimodal distribution, meaning many of our patients that we see with the down the leg sciatica pains are either relatively younger, where they've had some type of injury that leads to a traumatic disc displacement. A classic example is someone who is lifting a heavy weight maybe. But then there's also a fair number of patients who experience sciatica not from an acute disc herniation, but from basically a collection of arthritis that occurs with time. And so our older individuals.
Okay. So for a lot of people, managing pain is probably a lifelong journey, and living completely pain-free may not be achievable for everyone. So can you tell us about the treatment options that are available and ways that people can manage chronic pain?
Our goal for every single patient is what we call functional pain relief. To the extent possible, we want you to be able to do what you want to do without being quite so limited by whether it be your back pain or your other pain conditions. Now, certainly you have to take things with a grain of salt. If you're in your 8th or 9th decade, you're probably not going to be running marathons anymore. But we try and take a multidisciplinary approach to treating our patients with chronic pain. Much of what I do and what my partner Dr. Brooks does as anesthesiologist involves the interventional management of pain, but we also try and find a combination of medications that would improve symptoms for patients, always trying to balance the benefits for pain relief with trying to minimize side effects when at all possible. And then we're also very fortunate to have what's called a cognitive behavioral therapy program, the mind-body approach to trying to live or cope with chronic pain. We're trying to help equip patients with the tools to decrease the impact that pain has on their life. So, for example, some days your pain may be flared. Instead of the typical 3 or 4 on the pain scale, you could be up to 7, 8, or 9. And so what are some techniques that we could try and use, whether that be guided imagery, visualization techniques, biofeedback techniques, things to try and get you back down toward your baseline. There's a lot of active research in the pain management literature regarding biofeedback and mindfulness specifically, and we're fortunate to have a pretty comprehensive program here at ThedaCare.
Okay, thanks so much for being with us, Dr. Fischer. We appreciate all the great tips you shared.
Yeah, thank you.